Hi, Maureen. Hi, Michaela.
Hi. Hi, Doreen and everyone.
Hi, everyone. Hi, colleagues.
Hi.
Hello.
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 Doreen, I am checking whether my environment is clear. There is some construction going on in the hotel. The best place I can sit is in the hotel room. So are you hearing any sounds in the background?
No, not at all. You sound very clear. Yeah.
Okay, then that would be good for me. Thanks.
Michaela, is Mona joining us?
Yes, she will. Yeah.
Okay, that's great.
Hi, this is Hugh. Sorry, I've got my wife's name on the Zoom. I'll just switch account 1 second because it's a bit confusing. I'll join on the other account.
All right.
Good morning, everyone.
Good morning.
Good morning, Maureen, and changing there, we care. I don't know who's behind that. Morning,
It's
Michaela,
fine.
and
Good morning, Micah.
hi. Just to let you know, I have experienced challenges in getting the interpreter for this session. What I have so far are translated versions of the slide. Many thanks to Michaela, the Madagascar office, for supporting us on that. And I'm suggesting that perhaps we share these slides as a link in the chat box once everybody has joined, so that the French speakers can be able to follow through the various presentations in French. I'll also encourage the French speakers, of course, with your support, Michaela, to type any questions they may have into French, and then we can be able to address them using the translate feature on Google. This is very unfortunate, but we're here now.
Okay, that's noted. So that's all we'll do. You'll just put the PowerPoint, the slides in the chat box for them?
Yes,
okay.
that's the thinking, that's the plan.
Okay.
I'll put a link. And okay, and Maureen, will you, Bertha is also coming online. Hi, Bertha.
Hi, Bertha.
Hi, Bertha is a consultant with Child Frontiers that are also helping and supporting us on this work at the regional level.
Hello, how is everyone doing? Good morning. I'm sorry I'm late.
It's okay. Just doing a test run. Beth, I'm gonna forward to you the slides, the French ones,
Okay.
and then so that we can put them in the chat box as a link for the Francophone speakers. And in any case, any of the panelists speak French, you know, feel free to emphasize some of the points you're making in English into French. But if you don't, it's fine. And also, let us see how many of the Francophone speakers will join.
Yeah. Hugh, I just wanted to check in with you. Will you share your screen throughout the presentation?
Yes, I mean through my one presentation. Do you want me to just do that now, just to be on the safe side, just to make sure it's working?
Yeah, you could do
I'll
that.
just bring, I'm also going to plug these headphones in to make it a little bit, sound a little bit better, hopefully.
And then I thought we should agree. So we'll keep our cameras off and the microphones for all participants off, right? I thought only the panelists will have their cameras on while Maureen is introducing them, and then they turn off their cameras and only turn them on when each is presenting.
They're speaking.
Okay.
Okay. Yeah. Doreen, help me with the pronunciation of the names. I just want to make sure I bring out the names clearly.
Okay.
Like Salmon, we have Hugh. Is that the pronunciation?
Please, Hugh.
Yeah, Hugh Salmon, but with no L, like the fish salmon.
Oh, sorry. Yeah, Hugh Salmon. And then Habimfura.
Yes, it's Habimfura Innocent, yeah.
Habimfura, and then Dumba. Yeah,
Yes.
Dumba is quite familiar with for me. Yeah.
Okay, let's
Okay.
Ismail Dumba. Yes, yeah.
Thank you. I think
All right.
that's we're good to go.
Can I just check that I can share screen? 1 second. Does that look good if I present? Yeah, is that full screen?
Yes.
Yeah, great. Okay.
Perfect. Yeah.
And oh, but you added a logo, didn't you? Do you want? Should I put that? Should I take that from the deck that you created? You created a slide deck, didn't you?
I did. I did.
If I have a moment, I'll do that now, just to be.
Okay.
Yeah. Okay.
Do we need to project the agenda?
Do we need to? I didn't
Or
think
can
we would.
get through? Okay. I will do I'm following the run of show, so I will introduce what the learning platform is all about in this webinar, and then pass the floor to Maureen. Now introduce the panelists, and then we'll go with that flow.
Yeah.
And Bertha, you will come in at the end to do the closure and announce for any upcoming webinars, including the newsletter, etc. Is that okay? Bertha?
Yes, Mona, that is okay.
Sure, thank you.
Yeah.
Belete, Ministry of Belete, it's from the government? Ministry of Women and
Yes,
Social.
Ministry of Women and Social Affairs. This is
Okay.
Valletta. Yes.
Belete, Ethiopia.
Yes, Ethiopia.
Great, thank you. Just wanted to confirm that. A warm welcome. Happy that you've joined. We are just doing a sound check, and we'll start at 11 o'clock South African time, 10 o'clock Nairobi time, 12 o'clock Nairobi time, and many different times. But in the next 5 minutes, we should be able to start. I'll also send a reminder to the country teams that we're about to start. And I'm going to turn off my video for now and get some water. Betha, would we be sending out a survey for the introduction this time? Or should we just get the names in the chat box? Betha.
It will be okay if we do a survey, but also
Okay.
I will remind the participants to include their names and countries plus the organizations that they're representing on the chat box.
Okay.
Mm.
So I will, in the course of the introduction, I will announce that, and then you can launch the survey. And if you want us to stop so that we see who has who is with us to show the graph, you can let me know, or we do it more towards the end once more people have joined.
Okay. Do you have a link to the survey with you, Mona?
I have an old link, not the new one.
Oh yeah, I think that is the one that we're using at the moment. We don't have a new link.
Okay, let me post it and you can confirm if this is the one.
Okay.
Hold on. Now, what I have is to join the mailing list. That's the link that I have.
Mm-hmm.
Can you just post the, because what we did in the past was that you announce and then you launch it. You put it in the chat box and.
Yeah, but that is supposed to be done by the host.
Okay.
Only the host
Yeah.
who can share
So
the survey.
Because
Okay.
I have a poll and I thought we would launch it towards the end.
Yeah, that's the correct poll.
Okay.
Okay.
Great.
Great.
Thank you.
Right. Good morning, colleagues. Once again, it's now 11 o'clock Nairobi time, 10 o'clock South African time, and we have 13 participants. Kindly give us 2 more minutes to just give a bit of time for those colleagues and partners that are trying to log into this webinar. So we will start at 3 minutes past the hour. In the meantime, please introduce yourself in the chat box. Let us know your name, the office you're working from, and the title, your position in that office. Of course, most importantly, we're interested to know the country you're representing today. Please introduce yourself in the chat box. I'll start with myself. And great, thank you, Johannes, ministry, from the ministry. Okay, the number is going up of participants. We're now at 18. Wonderful. A warm welcome to all of you. We'll be starting this webinar in the next 1 minute. In the meantime, if you haven't done so already, kindly introduce yourself in the chat box by letting us know your name, your position, your work post, and the country that you're representing, but also most importantly, the organization you're from. Good morning once again. It's now 3 minutes past the hour, and we will officially start. Okay, the survey has been uploaded. Kindly take a minute to respond so that we can get an indication of where everybody is connecting from, whether you're from the government, from UN agencies, the NGOs, faith-based leader, academics. So maybe this will also be administered more towards the end. So let me start by introducing this platform. So once again, a very good morning to everyone. My name is Mona Aika, and I'm a child protection specialist for UNICEF East and Southern Africa Regional Office. A very warm welcome to all the government representatives who are with us today. I've seen a couple of government colleagues from the region. Very warm welcome to you all. And of course, our colleagues from Changing the Way We Care, from Maestro, and the CSO partners that are with us this morning in the region and possibly from outside the region as well. So before I start, a quick run through of the webinar protocols. We're requesting that you mute your microphones throughout the time, as we will have a session where for you to intervene and ask any question that you may have or make a comment based on the various presentations and discussions that will be had this morning. If possible, maybe requesting that we administer the polls at this juncture, but if not, we can do it towards the end. But I'm thanking all the participants who have managed to introduce themselves in the chat box. We also have the raise hand icon at the bottom, where you can use it to signal the organizers and recognize that you need to come in. The webinar is recorded. Requesting for this to happen, kindly record this webinar. And the purpose of recording this webinar is really to share with all of you and other colleagues who have not managed to join this morning. So the webinar recording is usually shared at the end of the webinar. Also, we have a mailing list. There is a link that is posted in the chat box, and we will reshare if you want to receive directly the monthly newsletters that are developed as part of this platform. So let me start this webinar by introducing the learning platform, what that is all about. A quick reminder for most of you, because I know we have regular participation by most colleagues and partners, but in the case this is your first time, the regional learning platform on care, has been established by UNICEF East and Southern Africa Regional Office in collaboration with Changing the Way We Care. And the purpose of this platform is really to exchange learning on care across Eastern and Southern Africa region. The management of the platform is supported by a consultancy firm, Child Frontiers. And with us today, we have Bertha and Ismail, the consultants from Child Frontiers, who have managed to connect with us today. And one of them will be a panelist. You'll hear more from Maureen a bit later. So the regional learning platform on care really provides an opportunity for government, UNICEF, CSO partners in the region. By the region, I mean East and Southern Africa, for them to share learning. And initially, we started this platform back in 2020, late 2020 in October. And we had a series of activities such as webinar sessions, virtual study tours, and we also have what we call a help desk, but it's basically an email, my email, or Changing the Way We Care email, where you can write to us if you have any question that you may have and you require further clarification. We are now in phase 2 of the platform that has been running from January of 2022 up to January 2023, and we are also in the process of mobilizing resources so that we can have phase 3, run phase 3 of the platform that will should smoothly, we should smoothly be able to transition from January into 2023 into the following year, into 2024. Just to also note and acknowledge the operationalization of this platform has been made possible with funding from the USAID Displaced Children and Orphans Fund through UNICEF SRO. So we recognize that support. Now to zoom in.
Hello, did we lose sound from Mona? Is there anybody else who's hearing?
No, I think we lost her. There's no sound.
Okay, let's hope she'll come back soon.
So, do we proceed? Hugh, do you think we proceed to introduce the session?
Yes, we could do that.
Okay.
Please go ahead. Yeah.
Yeah, thank you. Thank you, everyone, for making time to participate on this platform. As mentioned by Mona, we are coming together, and today's session will particularly focus on strengthening the social workforce. Let me put up my camera. Today's session will mostly focus on strengthening the social workforce for care reform. We will be looking at the key aspects of strengthening the workforce, discuss the composition of the workforce, the social workforce for childcare, and explore investment in the social workforce, what it means to us as childcare practitioners, the challenges that are involved, and possibly suggest the possible ways to address them. So the webinar will explore both the country-specific and regional and global perspectives of how we all have different experiences on the workforce. Our presentations will come from 3 panelists whom I'll introduce shortly. And at the end of the presentations, we will have plenary discussion. So as they go through the presentations, we encourage you to post as many questions as possible in the chat box. And also a polite reminder, as initially mentioned by Mona, that we turn off our cameras and also really keep on mute unless we have the opportunity to speak. So up to that point, I will request our panelists that as I introduce you, you turn on your camera so that our audience may get to interact with you. Our first panelist.
Maureen, kindly.
Yeah.
May I make a quick announcement about the translations and interpretation, and then we can proceed smoothly. I got disconnected. Dear participants, we had initially communicated that this webinar will have a French interpretation, simultaneous interpretation. This has not been possible, and we do apologize for that. However, there will be a series of presentations in which what we have done is to translate those slides into French. So for all the French speakers, we will request that you take a look at the slides. The links will be shared. Thank you to Betha for that. And you can be able to follow through. You may also ask your questions in French by typing them through there, and the panelists will be able to address these a bit later on. So that's all from my end. Thank you, and back to you, Maureen, for the introduction.
Thank you, Mona, and sorry about that hiccup. So we will proceed to introduce our panelists, and we appreciate them for taking time to prepare and come to share with us. Our first panelist will be Hugh Salmon. Hugh Salmon is the director of the Global Social Service Workforce. Hugh is a qualified social worker who, after practicing social work for 5 years in the UK, has worked for over 20 years, training and advising social service workers, managers, and policymakers across Eastern Europe, Asia, America, and Africa. In 2012, he joined the Family for Every Child and helped them grow into a global alliance of local NGOs, joining forces to improve children's care. In 2020, he joined the Global Social Service Workforce Alliance as the director and has since led a range of workforce strengthening projects at a global, regional, and national level. Join me in welcoming Hugh for our session. Our second panelist is Innocent Habimfura, who is a regional director for East and Southern Africa and director for Hope and Homes for Children, Rwanda. He is a trained social worker and lawyer. He is very passionate and dedicated to child protection, child care reform, including alternative care, deinstitutionalization, family strengthening, community development, community engagement, disability rights and human rights. He has facilitated learning exchanges and provided technical assistance in several African countries to establish foundations of national child care reform. He contributed to the advocacy and training of government social service workforce in Rwanda. So that is Innocent Habimfura. And thank you, Innocent, for accepting to come and share with us. Last but not least, our third panelist is Ismail Dumba Nyanzi, a care and protection workforce development consultant who is based in Uganda. He is a research and evaluation specialist with focused interest in alternative care for children, family reintegration and prevention for family child separation. He is a resident advisor for the D41 activity based in Kampala, Uganda. His most recent work includes facilitating the participatory care reform assessment process, and he also is supporting the Uganda's Ministry of Gender, Labor and Social Development in strengthening the collection, management, and use of routine data to improve the provision of alternative care services in Uganda. So to kickstart our presentations, I'll now invite Hugh Salmon, the Director for Global Social Service Workforce, to make his presentation. Over to you, Hugh.
Thank you very much, and it's great to be here. Good morning to everybody. I recognize some names and some faces already, which is great, and I'm wonderful to have this opportunity to speak to you from London. Apologies if there's a little bit of background where I am. I'm having some building work done in the house as we speak, but hopefully there won't be too much drilling going on in the background. So just to say that I'm going to just briefly go over our understanding of the social service workforce and how it can be strengthened, and the particular importance and benefits of strengthening it to achieve childcare system reform. So this first slide represents the range of people that are in the workforce. I think people are quite familiar with the fact that there's a very wide range of job titles used. So the ones on the left are just some of the ones in use, but on the right, on the left and right, you can see that they range from social workers to social educators or pedagogues. Sometimes those working in residential settings have a very specific title. Case manager is sometimes the job title, but is more often maybe the function that they're performing. But it's also important to mention paraprofessionals or parasocial workers, who are sometimes called auxiliary or assistant because they are working alongside the professional workforce, but also playing very key roles. So just to really clarify, why do we need to have the Global Social Service Workforce Alliance? Why is there such an emphasis in many different settings on strengthening the social service workforce? So those three words, why do we use those three words in that combination? Social service workforce. Why are we not talking about just social workers or the workforce of social workers or professionalization of social work? Those are all important things. But if we were to talk about professionalization of social work, it would be a bit like saying we strengthen the health system purely by professionalizing doctors. We cannot strengthen a whole health system purely by professionalizing the doctors. We have a whole range of professions and paraprofessions, just like paramedics work with medics, so parasocial workers work with social workers. And there are a range of other specialists and roles in the wider social service workforce, including community volunteers who are trained and tasked for this work. And ideally, they would receive some supervision. They also come under this umbrella that you can see in the middle of the slide to represent this inclusive concept of the wider social service workforce, the strengthening of which is so crucial to achieve change so that children can live wherever possible in their own communities and families. So the roles that they play, the social service workforce, including professional social workers and other roles, are both preventive, trying to prevent the need for children going into care in the first place and trying to prevent abuse and neglect in families, but also responsive, so responding to individual instances or cases where a child is considered to be at need or at risk, and promoting the wider workforce and advocating on issues that affect all of us and trying to change the underlying situation. And that work is happening at multiple levels: micro, the individual family or child; mezzo, across the community; and macro, which is the national level. So having looked at that, another slide just very briefly touches on the range of titles. We've done a number of regional mappings looking at what the workforce is composed of, and you can see the diversity of roles in there, 173 different titles. But it's not just that the social service workforce have a very important role to play in themselves, but they also work with allied professionals or people in allied sectors, by which we refer to teachers and members of the health workforce, members of the justice workforce, including police and magistrates, probation officers. So we very much have to recognize that the social service workforce can't do its job without collaborating with allied professionals, as we call them there. So this slide is probably familiar to many of you who have looked at our resources that we've developed jointly with UNICEF. This is our framework for strengthening the social service workforce, which we divide into 3 interlocking circles, because each one has to happen for the other one to be successful and effective. The top one is planning the workforce, which you do at the beginning, but also needs to be ongoing. To make sure that there's a strategic approach, it's data-driven, and that you look at the overall development of the workforce, the numbers that you need or the ratio to a given population, something that we've been working a lot on recently, and the budgeting and costing, obviously. Developing the workforce is really around the training and education and the ongoing support to their skills and practice. And then supporting the workforce comes alongside to really make sure that they receive adequate supervision and tools for the job, and professional associations really come into their own to raise morale in the profession and to make sure there is job satisfaction and retention. We don't keep on losing people from the workforce, which is often a problem. In the middle there, we reference the fact that all of this has to be done within the context of your specific country. And so the approach will be adapted depending on culture, local laws, the labor market economy, etc. So we have a number of things or key indicators that we look at to try and think, well, what things need to get better in order to have a stronger workforce, or what things need to be in place and then strengthened in order to have overall a workforce which is capable of delivering on care system reform. In other words, which is capable of strengthening families to keep children in their care and capable of delivering alternatives to large residential care, such as kinship care and foster care, enabling children also to return home to their families wherever possible with the required support and monitoring. So how do we achieve all that? There's a number of building blocks. On this slide, you can see them listed sequentially, and there's a link there. You can find all these resources on our website, socialserviceworkforce.org. If you look for our resources section, you can see these all there under the sort of, we have a set of a results framework, which is what this is taken from. I won't read each one of these individually, because in the next slide, I've turned it more into a bit of a diagram. And you could see at the foundation, when you're building your workforce, that there needs to be a normative framework which defines everything. What are the laws and policies which define who are social workers and other members of the social service workforce? What are their job descriptions? What are their required competencies? And what role do they play in child protection and in the wider childcare system? But you also need to have leadership at national level, which ideally brings together government, NGOs, universities, and others, as well as faith-based groups, to define the direction and what is the workforce, how it needs to be developed, what numbers are needed, and how it will be supported and monitored. And then as I go through this slide, I will build up block by block the things that we all need to be thinking about. Do we have this in place, or does it need to be strengthened? Have we assessed our workforce? Do we know who's in it so far, both in formal and informal roles, national, regional, and district level, or community level? So mapping and assessing the workforce is crucial. And we also have on our website a toolkit, which is open for everybody to use. We've done a number of those mappings, and we also assist others in doing a mapping and assessment of the current composition and strength of your workforce. That can inform a national plan and budget for workforce strengthening, which needs to be accompanied often by awareness raising campaigns, because although we've all had a teacher or a doctor in our lives and a nurse and a midwife, we can recognize all those roles because they're absolutely normal part of everyday life. There's nothing stigmatizing about having had a teacher or doctor or nurse in your life, and everybody has a good news story about when my life was changed by a teacher or a doctor. There are far fewer examples that most people can recall of a social worker making a big difference in their life. And that's one of the reasons why everybody from lay people, from politicians to business owners, and even the Minister of Health, or the Minister of Finance, or even the Minister of Social Welfare might not ever really know what we're talking about when we're talking about social service workforce. And many mothers and fathers are not too keen when their son or daughter says, I want to become a social worker. So there's a lot to be done to raise public support and awareness. We call it supply and demand. We need to have a supply of people going into the workforce. We also need to have demand. A family who's struggling needs to be able to say, I want a social worker, or I think it would help if I had social work support. So the public awareness comes on both sides about having people going into the workforce and those who may be in need of a social worker recognizing that that's a need and a service that is available for them. So carry on up. I've talked about the numbers, defining the numbers of social service workforce that you need for a given population. It's very much data driven, as I'm sure Ismail will be talking about later. Building on the evidence and the data that we have, you need to continue to collect that data. On the right there, you can see there's the need for that system of licensing or registration of professionals. And then you get into some of the detail here of the number of courses that are available, both in universities and shorter courses. We need to strengthen particularly, and I always stress this point here, the field placement. Just like you can't fly an airplane simply by reading a book about airplanes. You have to spend a number of hours or miles in the cockpit with somebody sitting next to you before you're allowed to be the chief pilot of an airplane. It's exactly the same in social work and as it is at being a brain surgeon. You don't let someone loose without practice placement, which needs to be supervised starting with during their training and education at university, but also when they do their first year of practice, they really should be supervised and supported to learn on the job and reflect in line with their theory and education that they're receiving. And so we need to look at the percentage who've received a good degree with at least a 3 months field placement that was supervised and assessed, because if they don't practice well, they should fail. Just like nobody should have a driving license if they fail. It's not safe for them to be on the roads. It's not safe to have social workers working with families unless they've been assessed as safe practitioners who are competent. So we need a competency framework which is practice-based. And it's the numbers who have adequate training. And then as we go up to the top of the pyramid here, we can see professional associations have a crucial role in holding those standards and the ethics and principles of the profession, which we see in a code of ethics, which needs to be known and used and applied so people can be disciplined and struck off, just like other professions would do if they don't work in line with that code of ethics. That's really important to stop abuses, but also to maintain the reputation of the overall workforce. And then above all, it looks like the cherry on the cake, but absolutely it's fundamental to the whole pyramid, the supportive supervision. Every social worker needs a supervisor, needs to be able to sit down every couple of weeks with their line manager, but ideally someone who is experienced in social work, to talk through difficult cases and to think what to do on those cases, not just to receive instructions, but to think about the work and to think how they're developing professionally, what further training they might need. That's what we mean by supportive, sometimes called technical supervision, but it really needs to be supportive and enabling practitioners to reflect and develop. Okay, that's the slide where I get really carried away, and I know that my time is running out. So I'm just going to briefly reflect on some recommendations that came out of a report that has been around for a few years now that we worked on together with the Better Care Network. It draws from Rwanda and also Moldova and Indonesia. So Innocent and others will know very well the content of it. You can find it in the link there that I mentioned. But I think just to highlight the learning that came out of there, which is still very strong today, and we're constantly seeing evidence of this, is that in order to strengthen the workforce, firstly, you need to bring together a diverse set of actors. So you need the government, the NGO, the universities, the faith-based organizations, all to come together with a common vision of who is the workforce, where are they deployed, how do they need to be transformed with their way that they learn and train, and the way that they come and recognize the need for this family and community-based approach that will transform children's care. We need also to have a policy reform process which relies on working groups and professional groups and developing of TORs and SOPs, etc. And then we need constantly to build and draw on the evidence base. So data is crucial, pilot projects are crucial. It's really when we've actually seen, for example, my experience, over 20 years ago now in Moldova, we only were able to close down a huge number of institutions in Moldova when social workers in small teams were trained to do the 3 crucial things of family support, to prevent children going into the institutions in the first place, reintegration to enable them to return to family care, and thirdly, foster care or kinship care where they couldn't go to their original biological family. Looking at how you can have pilot projects that then can be scaled up and learning from the evidence of implementing those. So those are practice models which need to be developed, referred to there. And some of those practice models will specifically look at linking the social work or the work of social service workers to social protection. So often called cash plus approaches. How do cash transfers, which are increasingly becoming available in your region, how does that get linked with more intensive case management? So that the family doesn't just get a small amount of cash per month, but they actually get a social worker coming alongside them to address some of the more underlying issues that might prevent them from providing quality care to their child. And all this should be done in a participatory way, because we need to learn from children and caregivers, how can the social service workforce be strengthened? And then finally, it's about shifting human and financial resources. You've probably all heard about the need for creating fiscal space, which is about taking money from the residential care institutions and making it available for new types of work, for family support, community services. But there's also a shift needed in the personnel, in the human resources. And that's not just physically redeploying them, so that they're working now with families in the community or with small community centers or possibly very small scale specialist residential units for temporary care as opposed to the big institutions. But not only are they working in new jobs in new places, but it's fundamentally an attitudinal shift. And I think I want to end on this point because that's often the big stumbling block with workforce change and workforce strengthening, is that we might move the people physically. They might have a different job title. There might be a different sign on their door saying, I'm no longer, this caregiver, I'm no longer a house mother, but I'm now a community support worker. But their attitude might be basically the same, which is something like, those families, you can't trust them. The best place ultimately for that child is to be back in an institution. And so the community stuff that I'm doing is only temporary because I've been told I need to do it. So we really need buy-in and ownership of existing workforce to shift to new ways of working and to feel encouraged and incentivized. Because ultimately, none of us really wants to change the way we work unless we feel that there is a positive reinforcement of working in the new ways. If we step out, if we stick our neck out, and all we face is ridicule or criticism or people telling us that why are you trying new things, you should stick to the old ways, then we won't get we won't get a change in the workforce culture. So we need to have encouragement and support and incentivization, and then behaviors within the workforce will change because they feel the rewards of trying out new ways of working, and they gain satisfaction from doing so. Thank you very much, and sorry if I went over time just a little bit. Thank you so much.
Thank you, Salmon, for the comprehensive overview of the social service workforce strengthening. I would like now to invite Innocent Habimfura for our next presentation. Innocent Habimfura is the Regional Director for East and Southern Africa and Country Director for Open Homes for Children in Rwanda. Over to you, Innocent, and I am projecting my screen for you.
Thank you, Maureen, and thank you to all participants who are on this call, on this webinar, on this Zoom. we are now confusing these technologies, and also the organizers, as well as the first presenter, especially because he has led the background for me to make my presentation much easier. And my presentation is really focused on child care reform and child protection. How do we connect the social service workforce? I think I will be using social workforce in general. Apologize for that. And to make sure we bring it on, the whole background shared by Hugh with what we do or what we focus on in child care reform. How do we work with the workforce? How do we support the workforce? I will put much focus on Rwanda. In March 2012, the Cabinet of Ministers approved the Rwanda National Strategy for Child Care Reform, and it put a cadre of social workers and psychologists among its priority to make sure the care reform was really effective or successful. It wasn't only, they didn't only put social workers and psychologists. Here I'm mentioning graduates, those who have done their bachelor's degree or master's degree in social work or psychology, but they also consider the paraprofessionals to support activities of, strengthening families and also supporting children to stay in their families at community level. And maybe if you go on the next slide. Yeah, as you can see on this simple chart or graph, at district level, in Rwanda, we have the national level, we have provincial level, district level, sector, cell, and village as the very smallest unit. The TMM or Tubarere Umuryango program, which is an implementation framework of the strategy, initiated having a social worker and psychologist at district level. And their role was much around case management, but also the awareness raising, running different groups of actors around gatekeeping. Gatekeeping here, I'm mentioning about different programs like supporting foster care, the recruitment, the training, the supervision of foster care to ensure children stay in families, and whenever there are in need of alternative care, they remain in a family-based alternative care. And they work in a collaboration with a gender and family promotion officer. And very recently, when the program of reintegrating children into families or transitioning children from orphanages and centers for children with disabilities started, they included as well the disability mainstreaming officer. In abbreviation, you can see DMO. And also they collaborate at sector level with a person in charge of social affairs who has also a degree either in education, in social work, or in sociology, or any domain which is connected to the social sciences, as well as IZU coordinator. IZU is a friend of family or a volunteer who support children in families at village level. But throughout this process, they do election, and then they will select who is going to be their representative and become a coordinator at cell level, and then at sector level to make sure there is a level of coordination of all those community volunteers. And all those are part of the para-professional social workforce. But in terms of the professional side, I will put much highlight on the social workers, the psychologists, and the IZU, as I mentioned. The others represent either a group of people who are served or persons who are served, as well as other networking, like those representative churches, faith-based, those representing the education sector, the health sector, the security sector, but I will come back on that. So it is structured at the level where we have the leadership of these social workers and psychologists under the National Child Development Agency. So that is at the national level. Can we move on the next slide? And maybe to show how this, or to demonstrate how social workers and psychologists are needed, not only from their background as those who are qualified or who have degree in such domain, but they needed additional training, pre-service training. They received also in-service training to make sure, on addition to what they learn at school, at their different universities and learning institutions, there is an addition of how to conduct a case management, from conducting an initial child assessment, family tracing, how do you do mediation, especially because this is a specific group of children who have been separated for very long with their parents. How do we deal with those separation wounds? How do you reconcile the child and the family? And so and so. So if I go through this protocol that I think would be a bit challenging for a non-professional to move with, you can see that the first stage is the initial assessment and the development of a care plan, which will give information that will lead to transformation, to tracing the family. And when the family is found, the family will be assessed as well. Then, and if they are assessed positively, I mean positively, which is different from positive in the medical sector, but saying that there is a possibility of reconnecting or unifying the child with the family, they receive intensive child and family preparation, plus family care, development plan, to make sure the root causes of separation are addressed. and support goes following an intervention plan, which follows an in-depth assessment to make sure the root causes are removed, but also the child is accompanied throughout a certain period to ensure there is smooth reintegration. But it can be negative. You found the family, but the family is not really ready, is not ready to welcome the child, or there are many reasons that could put the child in danger, or cannot facilitate the reintegration of the child. So in the best interest of the child would be placed in an alternative care, or in case the family was not found, the solution remained the alternative care. But for Rwanda, the decision was for alternative care to remain in the context of family-based alternative care. I will not go through the entire process, but the end of the process will be the family graduation, or closing the case and allowing paraprofessionals who are serving the entire community to include children who have been reintegrated and the family that welcome the children to really smoothly and sustainably stay in together. Can we move on the other slide? So all this process is really led by qualified social workers, qualified psychologists, plus additional training, and the training is a well-designed module, which is a curriculum which has 8 modules, but the module continue to be developed as they move on, because professional development should be part of building the capacity of our workforce to respond to the growing demand. There is another component, I think you also mentioned it. The social workforce is found also under prevention and the responses to child protection concerns. Here we are talking about a child who is in a family, who is in a community, but who is facing multiple child protection concerns. I'm mentioning multiple just because I'm referring to many children, but let's say a child who is facing a child protection concern. So there is a committee, and in those committees you'll find there will be psychologists, again, there will be officers in different roles, there will be member of the social protection. It's a very long list of people who are serving children in different capacities. So there is a committee. Currently, it is called the Child Development and Protection Committee, very recently developed by the National Child Development Agency, which come after another number of child protection committees that were established to make sure issues of children are addressed at community level. So there are many actors, including the disability mainstreaming officer, to make sure children with disabilities are not left behind, the gender and family promotion officer, the persons in charge of social affairs, the IZU, Inshuti z'Umuryango, as I mentioned, the Friends of Family, those volunteers, the paraprofessionals, par excellence in this sector. NCPD committees. NCPD is the National Council for Persons with Disabilities committees at grassroots level, and community health workers. So the number is long. Couldn't make the whole list, but we can refer to the list already shared by Hugh. So they will refer the case. Let's say this is a child abandoned, and they need direct support. I mean, something needs to happen. So the case management team, composed of psychologists and social workers, are going to assess, to find either the child will be reunited with the family, the extended family, or there is need to go for placement in a alternative care, or either in family care. But the decision will be done in consultation, or consultation with the Child Development and Protection Committee. So now a big number, which together they will decide on what should be done. And through this network, this working together of these different actors, actually they meet once per quarter in a district, and once per month at sector level. This committee will be equipped through a number of training to really be not only skilled in providing support, but also sensitive on issues of children. It's not rare to find different actors, including local officials across the region, seeing children in child labor, maybe in tea plantation or in other, let's say, in other activities that in other kind of work that is not age appropriate. But it will be like seen like that until people discuss it and they make those actors more sensitive to those issues. And at the end, you may find that either children, I mean, families who are going through either crisis or just they are at risk of separation receive support through the social protection, because even those who are under the social protection are part of the committee. So the linkage from the professionals with those paraprofessionals, I mean, or those members of the network around the child will be responding. And here I will mention the practice which is not represented here, like the police. The police has already a unit called the Isange One-Stop Center. So whenever there is, let's say, a gender-based violence, sexual violence, or child defilement, the case managers will report it immediately to that service, and as I mentioned, the police is also part of the committees. So they will already, they are already prepared to welcome such situation and continue to collaborate, while the social workforce will work on how the child will be supported in a kind of continuum of care. So the professional social workers and the psychologists will continue to link the possibility even of children who are in alternative care, how are going to return again in the family for the sake of permanency. So you'll see that social workers, together with psychologists, are playing a key role in the reintegration of children in families, but they play a big role in preventing children from being separated from their families, and also address any child protection concern by connecting with the services that are habilitated, even if in some circumstances they may not have the so-called social service. Can we move on another slide, please? Yeah. In brief, I've shared the experience of how Rwanda brings in the professional social workers together with the paraprofessionals to make sure the responses are timely provided in terms of prevention, but also in case of child protection, a need of response, it is also coordinated because of a number of other service providers who are not like accessories, but who are also pillars to make sure the social workforce work, effectively. Thank you, Maureen.
Thank you, Innocent. Thank you, Innocent, for the very good presentation about the concept of social service workforce in Rwanda. And before I welcome our next speaker, I would like to remind our participants that we can write down the questions in the chat box, and we will have the panelists respond to them during the panel discussion. Allow me to welcome Ismail Dumba, the Care and Protection Workforce Development Consultant, to make the final presentation. Over to you, Ismail, and I will continue to share my screen.
Thank you so much, Maureen, for that introduction, and thank you all the presenters before and the participant. My name is Dumba Nyanzi Ismail. I'm based in Uganda, and I'll be speaking about why it's important for governments to invest in social service workforce strengthening. Next slide. Just a little for context. Um, a lot of the countries, especially in the region, are striving to reform their care systems to ensure appropriate care for children who are, without or at risk of losing parental care. And if you look at the care system reforms across countries, they largely focus on strengthening the capacity of families and communities to care for children. They are focused around addressing the care and protection needs of vulnerable or at-risk children to prevent separation from their families. Efforts are also centered around decreasing reliance on residential care and promoting the reintegration of children, and also ensuring appropriate family-based alternative care option in the countries. And what we see across, several countries in the region is that they are adopting a system strengthening approach. So the idea is to focus on all elements of a system to ensure, a more coordinated and holistic way to strengthen the care and protection for children. But one of the critical components of this system strengthening approach is the social service workforce. And we all appreciate, how important it is to have an adequate and qualified social workforce. Of course, both government and non-government, professional and non-professional, like my friend Innocent has highlighted. Next slide. Now, in the context of the ongoing reform, we notice that, of course, the social service workforce plays an important role in supporting children and families, but also children outside family care. And we've seen, and Innocent has articulated this very well, we've seen the key role that the social service workforce plays in preventing family separation, supporting the reintegration of children, but also determining and ensuring the suitability of alternative care placement. And each of these, of course, these are broad roles, but I was looking at, for example, the Probation and Social Welfare Officer Handbook in Uganda, and of course other manuals for the social service workforce across the region. And distinctively, if you look at the role, next slide, please. If you look at the roles and functions of the social service workforce across countries, it can be broadly categorized into 5 areas. One is the support and care they provide, protecting children from harm by mediating in, for example, family conflict or identifying and managing risks. But also, the social service workforce plays an important role in gatekeeping and care planning, service management, service development, as well as quality control. And then the other often overlooked role is the coordination of efforts and resources and providing systems of support for children and families across sectors by either providing direct services, but also referral to appropriate services, which services could range from family support and early intervention or child protection to address abuse and neglect, and then alternative care for separated children. And when you look at care planning, you also have to speak about the role they play in assessing the child and the family to recognize what their support needs are and what the risks are, that could potentially lead to separation, and providing early support to minimize the risk of this. Of course, all this work requires, specific skills and competences which have to be, next slide please, which have to be built, but also this kind of work that the social service workforce plays requires investment in resources and appropriate support for the social service workforce. I was looking at the recent needs assessment, training needs assessment conducted for the social service workforce in Uganda, and there are several areas that are highlighted, but key among the kind of skills and competences that the social service workforce needs is case management skills, skills in case planning, skills in assessing children and families and determining appropriate forms of support, the social intervention skills, including trauma-informed care and basic counseling, but they also need, access to a range of tools and guidance materials to be able to fulfill their roles and functions. And that, I think, sort of provides or justifies why it's important for us to be investing in the social workforce. And one of Hugh has already presented this, but I think this sort of provides a very good framework for investing in the different areas required to enable the social service workers fulfill their roles. So there need to be investment in planning for the workforce, and this can take several forms, including making sure that we ascertain what vacancy rates are available, and plan for recruitment and filling those vacancies. We need to be able to have access to the number of social service workforce we have and we need to serve the vulnerable children and families, and making efforts to make sure that we have an adequate workforce. So all this entails and involves planning, and as governments in the region, we should be and some countries have taken steps in investing in workforce planning. And then there is developing the workforce, which is important. And if you look at the region, the range of both in-service training and pre-service training for the social service workforce. And for the pre-service training, we have to recognize that not all that the workforce that supports vulnerable children and families are actually social workers. Sometimes there is actually a misunderstanding that it's only social workers, but we need to look at a whole range of cadre, like has been presented by Hugh and Innocent, and make sure that they have the appropriate skills and competences to do what they are supposed to do. And that includes paying attention to the curricula for the in-service training, rather the curricula for the pre-service training, but also what kind of training we provide in terms of in-service training. One of the challenges is that I've often found is that there are a lot of trainings that, for example, go on in Uganda for the different cadres, but these trainings are not always harmonized, and they are sometimes duplicative, and there is no standard way to link the different in-service trainings to the competences and skills required for the social service workforce to perform their role. So harmonizing all this, I think, is really important. And then what kind of professional development opportunities do we provide for our workers? Do we have a system for continuous learning and continuous professional development courses? And I really made a quick search before this presentation to understand what kind of continuing professional development courses exist. And in Uganda, I didn't find any, but I might be corrected by other people. So we need to be investing in some of these things to make sure that we have the right cadre, we have an adequate workforce, but also that is skilled enough to be able to deliver on the functions that we expect them to do. And then, of course, the other issues around supporting the workforce. And I think this is very important, especially if we look at you know, for example, what kind of support supervision is provided to the workforce, either by the professionals to the non-professionals, or by, you know, some kind of peer support between professionals. What kind of resources are available to them to improve job satisfaction? And I was looking at a report, one of the reports that was authored by Dr. Genestic. It was actually a functional review of the government social service workforce in 2019. And I think she's very scorching and very succinct in her analysis of some of the challenges that the workforce across in Uganda, but I know that this also pertains to other countries. She indicated that a combination of limited logistical, administrative, and technical resources impacted on the social service work environment. In the report, for example, she highlights gaps in job-specific competences, but also she highlights issues of staff burnout and low staff morale caused by poor remuneration, but also lack of you know, opportunities for self-development. And as a result, if you, for example, don't provide adequate remuneration to the social service workforce, one of the consequences that she found is that it became clear that a lot of the cadres had become selective on which role to play and which ones to relegate or completely neglect, depending on where they anticipated some financial benefit. And I think it goes back to, how do we support our workforce? How do we remunerate them? How do we provide support supervision? How do we attend to the issues that they raise and provide feedback on where they find challenges? And I think it's important to pay attention to this, and including providing adequate resources, including job aids and materials, as well as guidance that they need to perform their role fully. Since we have a limited time, I'll next slide, please. Just looking at the social service workforce in general across the region, there are some lessons that I wanted to highlight in this presentation. One is that we all are aware that that a strong, aligned, and competent social service workforce is critical to meeting the needs of children without or at risk of losing parental care. And some of the key roles have been highlighted in this presentation, but also by Innocent. The other important aspect that we find in literature around social service workforce in the region is that investing in the social service workforce yields high return for childcare and protection. At least we know this qualitatively. But I think going forward, we need to conduct rigorous evaluation of how investment in specific aspects of, you know, investment in specific aspects related to strengthening the workforce impact on specific outcomes, for example, for children. And I think that would be important for us to strengthen the evidence base. We also learned that low investment in the workforce undermines all other efforts to strengthen the care system in a sustainable manner, including enforcement and implementation of laws and policies. And we've seen this, you know, consistently, through our interactions with the workforce in Uganda, where you know, people are, you know, the workforce are not aware of the policies or the guidance or the laws that are available and how to apply them in practice. So we need to provide ongoing training and mentorship. Some countries have mentorship programs and others don't, but I think it's important that we do invest in some of these to provide hands-on mentorship and support to some of the social workers, especially those that are newly recruited and getting to grips with their roles and function. And we also notice that, you know, the changing paradigms around care and protection requires a multi-pronged approach, and there are several, and Hugh highlighted a lot of this around how do we shift the human and financial resources, how do we coordinate and work with the different cadres, how do we provide opportunities for self-development and self-care to address issues of burnout. So it's not just investing in one aspect of strengthening the workforce. We need to pay attention to all areas that I've highlighted in the previous slide. But also, I think moving forward, we need to invest in research to clearly define the added value of strengthening the social work, the social welfare system. For example, we need to, there's need for more research to understand the economic benefits of investing in the social service workforce and the cost of not investing, because often when, for example, the Ministry of Social Services or social welfare in countries go to convince the policymakers and those who allocate financial resources, they demand evidence of what, for example, a particular training would yield in terms of economic returns, and sometimes it's very difficult to explain. So bringing our heads together and investing in research to understand how not just the social returns of investing in social service workforce, but also the economic benefits, I think would be a key moving forward. Thank you.
Thank you, Ismail, for that very good presentation, especially on the key reasons why we need to invest in the workforce. I will now request us that we now turn to the panel discussions, and our panelists will respond to a few questions. Doreen will help us to monitor the chat box. Doreen will help us to monitor the chat box, and we will be seeking to get clarifications from our panelists. Doreen, do we have questions in the chat box so far? Over to you, Doreen.
Thank you very much, Maureen. Yes, we have about 4 questions in the chat box. And the first one was on the composition of the parasocial workers. I think Hugh addressed it in the chat box, but he could do it again so that people who didn't get the chance to read it can understand who the members of the parasocial workforce are. And Innocent could also contribute. I think the question was directed at Innocent. I will share with you the rest of the questions as Hugh or Innocent responds to that question.
Okay, over to you, Hugh. Kindly take the platform.
Sorry, this is the question about paraprofessionals, is that right?
Yes, it is.
Yeah. Yeah, so as I mentioned, I mean, it's quite hard to generalize, but the best analogy is, as I said, with the health workforce. For doctors to do their job effectively, there needs to be a whole ecosystem of other professionals, from nurses to midwives to public health workers who do health promotion. So in the same way, for social workers to do their job effectively, and we absolutely do need to have professional social workers who've received the kind of degree with practice placements that I've talked about, and are members of a professional association, they're licensed professionals. We absolutely need them, but the ecosystem is interlinked. Yeah, they cannot do their job without the existence of others, just like doctors cannot work without nurses. Yeah, so we need to have auxiliary staff. The paraprofessionals are a combination of working alongside. So if a social worker is very busy, doesn't have a vehicle, or doesn't have time to do any home visits, or just has too big a geographical area, then paraprofessionals, parasocial workers may be doing home visits, being actually out there in the community, identifying needs, and as many speakers have said, connecting people with the services that are available. Because when social workers are just too few, or they're only in the center of a district and they can't get out to the communities, then families will always fall through the cracks. They might see one person who can help them, but that person doesn't know about all the range of other services that could be available. And then that child could easily fall back at risk of going into institutional care because the right kind of service was not available to them, or they didn't know about that service. So just as Innocent and Ismail was saying, the paraprofessionals are in the community. They don't necessarily have a university degree, but they have received some specific training, and they're also supervised, which is crucial. They may or may not have a full salary, and that varies. Some of them are volunteers with a stipend. Some of them do have salary, and they're employed either by government or NGO. But just the roles that they play vary enormously. I don't know if others might have other examples. I hope that answers the question to some extent. Thank you.
Thank you, Hugh, for that comprehensive response. Doreen, do we have any other question for another panelist from the chat box?
May I intervene first? Just
Yes.
shortly.
Mm-hmm.
Yeah. I think Hugh mentioned that very clearly, but I want to change it a bit in terms of the question and the response. I may be saying that there is even that need of recognition. I'm taking it from his presentation, the need to have a strong association of social workers to define and push recognition of the profession itself. Because in many countries, even that doesn't exist. So you can't even think about, or you'll not be in a situation to think about para-professionals when even professionals are not strong and not recognized as such. And that means what? You have the professionals maybe who may have degree. So the academic part has played its role, but that does not mean that they are equipped to go and work straightforward with families and children who are undergoing different situations. And again, there was that idea of ethics. Ethics is built around the associations. Maybe I'm bringing that element as the president of National Organization of Social Workers, and we are still struggling in building that recognition, which means that some members of the social workforce, I think I'm very sure Ismail knows this situation, will be actually health allied. But for the social work sector itself, because it's still trying to build its recognition, and it's an area where we will need support from those who are advanced to be recognized. And before being recognized, I'm not even seeing the government putting resources in it. That's why if I could bring the new element is how do we strengthen the professionals themselves so that they bring that link with the paraprofessionals. So in action, or when you see it on the ground, the paraprofessional exists, as I mentioned, they are part of the network to make sure they receive some training, they receive some supervision, but I think there is still much to be done to make sure the supervision has some level of standard, the ethics is followed with some standard. So we have much to construct around professionalizing the workforce to make sure even paraprofessionals receive enough support. I'm using enough because they may have training and supervision, but is it really reaching the level of standard to call it professional? I'm very convinced having that built in that sense, where paraprofessionals have support of professionals who are fully professional in terms of work and the qualification, the result and the outcome on families and children or whoever is served by the professionals is going to be better. The outcomes are going to be better. So in our understanding, we need to construct the professional aspect alongside the paraprofessional aspect. I was not recalling the membership because Hugh mentioned it very clearly. Thank you.
Thank you, Innocent, for that contribution. I would like to check with Doreen if we have any question around Ismail's presentation, especially around investing, why we should invest in the social service workforce.
Thank you very much, Maureen. Yes, there's one question for Ismail, and it's the question is, how do you deal with planning and strengthening of the social service workforce in a situation like Uganda, where the cadre responsible for professional social workforce service delivery is expected to perform all sorts of roles beyond the realm of social work, and pressure from those other roles overshadows the social service role that is poorly clarified and poorly funded?
Thank you, Doreen. Over to you, Ismail.
Thank you so much. First of all, I think we need to thank you, Daniel, for the question. We need to recognize that when we speak about the social service workforce, we are not only speaking about social workers. We are speaking about the different cadres that play a key role in supporting vulnerable children and families. And this could be psychologists, they could be, from entirely different professions. So the social service workforce, I think, in terms of cadre and definition, goes much more beyond, how you typically define who a social work is and who is not. And then I think it takes, and you rightly said, planning. So it takes commitment and intentional efforts from the government to define what cadre are needed for which specific roles and function. Because without that, then you're going to dump each and every function to one cadre. And then that can be counterproductive, because no one single person can fulfill multiple roles even beyond their training or competences. So you need to really define, and I'll give an example of an example from Rwanda when they were talking about deinstitutionalization. They defined that yes, we need social workers, but also we need psychologists, but also we need the ISU, who are the community volunteer. And within that process, they defined what the role of each cadre is going to play in the deinstitutionalization process. So I think planning involves also understanding what the task at hand is, and then which cadre would be best suited to performing specific roles and functions, and then working to align and coordinate their different roles. And I think that's a gap. But luckily, cognizant of that, we've seen some pilot projects in Uganda where, for example, UNICEF has supported the piloting of a new cadre, which is the social welfare officers at the sub-country level, to sort of alleviate the burden on the probation and social welfare officers at the district. So I think that that's a commendable effort, and it tells us that you need to continually reflect on what role and function you expect a particular cadre to play, and revising those roles continuously, or training them to adjust to those roles going forward, either through retraining, in-service training, and also planning. The workforce involves balancing the demand and supply side. So for example, one of the challenges why we have a lot of the social service workers across the region complain of the heavy workload, or burnout, is sometimes as governments we've not thought about what the appropriate workload is. And internationally, when you look at the guidance documents, there are recommended ratios of social workers, for example, to vulnerable children and families. But you can see from the data that across the region, those ratios far exceeded. And I'll give an example. from some of the children homes we've worked with, the recommended ratio is 1 social worker to about 10 children. But in most cases, you find there are 2 social workers in a children home, and there are 100 children. So how do you, I mean, it all goes back to planning and understanding, and balancing the workload and recruiting more staff and addressing, vacancy rates that we see, and training, and also making efforts to retain the workers that you have.
Thank you, Ismail, and our panelists for the responses you are giving directly in the discussion as well as in the chat box. Members, I really urge you to go to the chat box. There are a lot of contributions there. We are 8 minutes to the end of our session, and I would really like to wrap it up by thanking all of us for the discussion. Now that we are caught up with time, we hope to have any other unanswered questions that will be posted in an article, and we will post that in this same learning platform. So in case your question has not been responded to, be sure that we will ensure that we share the responses on this learning platform through an article that we will put together. So in my wrap up, I would like to thank all of us for making time to join this webinar, and I hope that you all found it useful. Indeed, matters of workforce are the make or break for our care reform efforts, especially like globally and even regionally. So I really would like us to watch out for a video recording of the webinar that will be posted on the learning platform and on the Better Care Network platform. An article on strengthening the social service workforce will also be shared on those 2 platforms. And thank you all, our panelists, for the brief and yet comprehensive and rich presentation. Before we sign off, I would like to hand it over to Doreen to facilitate us on a poll that we are requesting all of us to take, as we encourage you to respond before the end of the webinar. Once again, thank you for the day, and have a good afternoon, morning, or evening. Over to you, Doreen. Kindly support us to take the polls.
Thank you very much, Maureen. I think Betha is doing this. I've launched the poll. It's on your screen, so please just respond to the questions. There are only 2 questions, but I think there's some updates from Betha. So over to you, Betha. Thank you.
Okay, thank you, Doreen. Thank you, Maureen, for also facilitating this session. It has been an interesting webinar, and I must say that I've learned a lot of things today. Thank you so much to our panelists. Thanks to our participants for joining us today, and for everyone who worked to ensure that this webinar is successful. So from the Child Frontiers team, we will send out the September newsletter next week, and the newsletter will focus on the role of community volunteers in supporting care reform in Rwanda. So please subscribe to our monthly newsletters through the link that I've shared with you on the chat box, and you'll be able to learn very many success stories about community volunteers in Rwanda. And I believe that we can also get something, we can also borrow something from what they do. Apart from that, we will also announce the next webinar on the newsletter. So feel free to also check out on our newsletter when I share it out with you next week. And Changing the Way We Care also has a document that talks about the process of ensuring kafala is considered a family-based alternative care in Kenya. And the document will also be shared on the newsletter. So I'm looking forward to receiving so many new subscribers. And if you intend to advertise an event or also share resources in regards to care reform, please feel free to reach out to me or Emily. I will share our email addresses on the chat box. Thank you so much. Back to you, Doreen.
Thank you very much, Betha. I think what we have to do now, for those who haven't completed the poll, please do so that we know who is present. It also helps with planning for future webinars. Otherwise, that's all from my side. Thank you.
Thank you, everyone, and hoping you're through with the subscription. Please remember to subscribe for the monthly newsletters and also the polls. Otherwise, we are free to drop off, as we appreciate all of us for the participation.
Thank you, everyone.
Thank you.
Betha, can you see the poll results? Maureen, do you see the poll results?
Not yet. Are you projecting?
Yeah. There's
I'm
several
seeing,
people who have responded.
I'm seeing like 67% for question 1.
Oh,
Okay,
okay.
I'm seeing some. Yeah, they are.
Okay, thank you. Maureen, I think I'm going to end the webinar now. So thank you everyone for participating. Bye-bye.
Bye.